loosen them, right? They're easier to palpate when the knee is slightly flexed. If the knee is extended, very difficult. Okay, so just then you can palpate along here. So this is the medial and this is the lateral collateral ligament, right? And the tibial plateau as well. So tibial plateau, and that should be quite sufficient for palpation of the knee. Also, don't forget to check the back, right? So when you're checking the back, you can do a couple of things, right? So you can place your thumbs here in the joint space, and then you can actually hook your fingers in the popliteal fossa and feel in and around, see if there's any Baker's cyst. Okay, Baker's cyst, which is present. It's also a good opportunity to check the popliteal artery pulsation while you're at it, because your fingers are right there. So, yeah. See if there's any fluid collection, basically any Baker's cyst which is present. Yeah, so that's pretty much palpation. And then what you can also do, this is something that you mainly do if they're complaining of shin pain, right? Or if somebody who's very active, like a runner, they overexert themselves. Yeah. You can actually tap, right? So you say, I'm just gonna tap, right? And see if there's any pain, right? Another test that you can do, but then the leg has to be extended. If you suspect that there's a stress fracture of the tibia, you have to basically ask them to point the toes towards the ceiling, yeah? And I'm just gonna strike your heel, and I wanna know if you have any pain in the shin, right? So then you basically strike the heel like that, and she doesn't have any pain, but someone with a stress fracture definitely will have some degree of pain when you do that. Yeah. Yeah, so this